want to specifically thank you for allowing me to take part in this today, because it's so very important. And to every one of you witnesses, thank you so much. This is such an example of how important it is that we talk to each other and we listen to each other. It makes an incredible difference how we move forward. And I also want to make a comment about Dr. Wenstrup and how, with him being a congressman as well as a physician, I think he really has a perspective that is very fair and something that we should listen to, because that has been his life, and he can share things with us in a very bipartisan manner. West Virginia has been leading the nation in distributing vaccines. On Wednesday, our governor, Jim Justice, announced that if West Virginia were its own country, it would rank 7th in the world for its rate of vaccination. Given how rural our state is, this has been a mammoth undertaking from federal, state, to local communities and stakeholders. West Virginia has come together to ensure that we can efficiently and effectively get the vaccines to those who need it the most. No two states are the same, and that is why we cannot mandate a one-size-fits-all approach to vaccine distribution. However, we have seen many states tie their own hands, and they have gotten into political correctness of who should be vaccinated and when we must keep our eyes on the ultimate goal, which is vaccinating as many Americans as possible, as quickly as possible, so that we can reopen our economy, reopen our places of work, and get our kids back into school. Dr. Marsh, thank you for your testimony. You illuminated the great efforts West Virginia has undertaken to save lives. Will you elaborate on the success of Operation Save Our Wisdom and tell us why this was such a critical first step for the state to take?
Thank you, Congresswoman. Well, and thank you for your service to our state and for each person here. This is absolutely a bipartisan issue that we're dealing with. One of the things that's really striking, so Governor Justice really focused our vaccination priority on our older part of our population. But for those of you who don't know this data, it's something that I find incredibly powerful. This is CDC data. So if you compare 18 to 29-year-olds who are infected with COVID-19, and you look at hospitalization risk and death risk, then 50 to 65-year-olds versus 18 to 29-year-olds have a 30 times risk of death and a 4 times risk of hospitalization. 65 to 75-year-olds have a 90 times risk of death and a 5 times risk of hospitalizations. 75 to 85-year-old Americans have a 220 times risk of death and an 8 times risk of hospitalizations. And Americans over 85 have a 630 times risk of death and a 13 times risk of hospitalization. So as we target and focus on saving lives and reducing the burden on our hospitals, then it becomes very obvious that we want to vaccinate our elders. And as I mentioned, our nursing home population was half of our as it has been in many other states and countries. And today, in many of our nursing homes, we have no outbreaks. We have single numbers of death across whole nursing home segments. So this approach is highly effective. And I would say, and I've heard Dr. Czar talk on TV before and other people, that I think a single dose of these vaccines is very, very effective. And I'm not saying we shouldn't vaccinate with 2 doses, as FDA has said, but it is really, I think, incumbent upon us, particularly with the viral variants that are starting to come forward, for us to get as many first shots in the arms of as many of our citizens as possible. And if you target our older population, then you have a fighting chance at really not only helping reduce the replication errors, the variants, but also of saving a whole bunch of lives. And in West Virginia, as I say, over the first 7 weeks of 2021, we've seen an 85% reduction week to week in deaths in West Virginia. Thank you.
West Virginia also has had a unique utilization of local pharmacies in distributing vaccines to our rural communities among the hills and hollers. Can you describe how West Virginia has tackled the challenges of rural healthcare?
If you can briefly, thank you very much. And thank you,
That'll
Ms.
be
Miller.
very short. Well, thank you, Congresswoman. I think this is really, really critical because this is where the personal relationships come in. And for instance, in our nursing home population, I think national average 71% of the residents and 30-some% of the staff, because of our pre-existing relationships, we had 85% of the residents and over 65% of the staff agree initially to be vaccinated. So this is really about us caring about each other and giving these personal relationships an opportunity to really make an impact.
Thank you so much. I yield back.